Great. Welcome to the webinar, Strategies to Advance the National Adult Immunization Plan through a Focus on Influenza, developed by the Gerontological Society of America and supported by Sanofi Pasteur. The webinar is being recorded and will be posted on the GSA website. A notice to all attendees will be distributed once the recording is available. A question and answer session will immediately follow the live presentation. We will be accepting questions through the questions feature accessible on the right-hand side of your screen. My name is Maria Gorick. I'm the moderator for today's program, and I'm a program manager at the Gerontological Society of America. Our speakers are Angela Shen, who is the Senior Science Policy Advisor at the National Vaccine Program Office, which is part of the U.S. Department of Health and Human Services. And we have James Appleby, who is the Executive Director and CEO of the Gerontological Society of America, GSA. We are all pleased to be a part of this important program. Without further delay, I'll hand the microphone over to James Appleby. Welcome.
Thank you very much, Maria. And let me add my welcome to Maria's. We are delighted to have all of you on today's webinar, which we think you're going to find to be very compelling and we believe helpful to you in your individual activities as it relates to your own individual immunization work, as well as the work inside your institution and health plan. As you'll see, as you look at the agenda, I'll be setting up the webinar a little bit with some opening remarks, and then we'll hear from Dr. Shen to talk about the National Adult Immunization Plan. And then I'll be closing out with a report on some of the key insights that emerged from a day-long program that GSA hosted in the fall of 2015. And then we will have time at the end for questions and answers, so please do indeed let us know what questions you have. Moving into the webinar, today's webinar, the timing is quite good for us because this is National Immunization Awareness Month. I don't know if those on the call were aware of that or not, but August is National Immunization Awareness Month, and really helps to set the stage right here at the beginning of flu season in the Northern Hemisphere to get people thinking about immunizations. And the first week of August, each week has a different focus. The first week of August is actually dedicated to older adults, so our timing is quite good. Now, today's webinar is being developed under the auspices of the Gerontological Society of America, or GSA. It's how we abbreviate that. For those of you who aren't familiar with the society, we are a multidisciplinary organization of professionals who are either researchers, clinicians, or educators in the aging field. Our members focus on aging across the lifespan. We don't solely focus on 65 plus, but we focus on aging and aging across the life course. We've got a real focus on this issue of improving adult immunization rates. It's something that society has been working on for more than 5 years since we founded the National Adult Vaccination Program. On the slide that you'll see there, we have the 7 members of the work group that oversee our National Adult Vaccination Program, or NAIP. As you'll see, they come from a variety of different organizations in academia, in private practice, and in a medical group association. It's headed up, the work group, by Dr. Gordon Douglas, who has had a very long and distinguished career in the area of infectious disease and immunizations. This work group has really taken its time to develop a roadmap for how we can improve the adult immunization process here in the United States. They've produced quite a number of white papers and resources, and most recently have developed a program to stimulate the establishment of new champions. It's called our Immunization Champions, Advocates, and Mentors Program, and we're working through graduates of that program to improve immunization rates locally. Now, today's webinar is going to focus on strategies to advance the National Adult Immunization Plan. It is indeed going to focus on influenza as sort of a case example, as it were. The National Adult Immunization Plan was in draft form last fall when we hosted this conference. And the intent of hosting at that time was to very early on in the process begin to get ideas for how the draft plan could be implemented. That plan is now final. It's finalized earlier in 2016, and Dr. Shen will be talking about it in some detail. But we chose, through this one-day program focusing on influenza, we chose that as sort of a case example because of the enormous impact on public health that influenza has. The fact that it is an annual need to protect our members of our society, and because it's really sort of a jumping off point for efforts to increase immunization rates for adults across the life course on every age-appropriate immunization. Now, the stakeholders who were invited to the workshop are shown here in this slide. 16 different organizations participated at the workshop, and some of the organizations you'll see represented here you would imagine would participate in this type of activity, and a couple others are sort of, wow, wonder why they're interested in this. And for example, we have individuals here from the American Occupational Therapy Association. Maybe not a group that you would imagine would have a big focus on influenza. But indeed, it's sort of representative of the fact that we're trying to identify new avenues of access for adults to get immunizations. We're trying to bring new players into the fight, and that's just one case example of the organizations that were represented at this day-long conference. Now, we did ask the attendees at the program how active you are in the immunization arena. And sort of apropos my earlier comment, about 2/3 have been very active in immunization efforts for quite some time. But clearly 1/3 of the stakeholder groups represented are either new to it or just now really launching their efforts to become more actively involved. So we had a lovely mix of representatives at the conference. Now, since that meeting last fall, we have done a full reporting out of the event, and that publication is available at www.navp.org, as are quite a number of other resources available through the National Adult Vaccination Program. And then the other reporting out we wanted to be sure to do was through this webinar to provide an opportunity for interested parties to not only hear about the activities but also ask questions in a very interactive format. With that, I would like to turn it over to Dr. Shen to provide an overview and insight into the National Adult Immunization Plan. Dr. Shen?
Great. Thanks so much, James. Thanks for the invitation, and thanks for GSA and your members' unwavering support of immunization. So today I've been asked to talk about the National Adult Immunization Plan. I begin with a quote that vaccines are the tugboats of preventive health. This quote by Bill Foege, who many of you may know in global health, really kind of characterizes why vaccines are special or a bit different than other interventions. The second quote on the next slide really encapsulates how we can advance public health goals toward healthy people targets and toward the healthier population. And the way we do that is together, given that the whole is greater than the sum of its parts. So the vaccine and the vaccination system in the U.S. is a bit complicated. We use this slide to kind of characterize a number of boxes that show a lot of linkages amongst the boxes. We start on the left side with disease prevention and translation of research that leads to the development and licensure of a vaccine. And after licensure of a vaccine, there are a number of factors that influence whether or not folks will get vaccinated or get their families or children vaccinated. Attitudes, communication and education strategy, government recommendations, all moving toward the right, toward high vaccination rates, which are merely an indicator or a litmus test of population health, with the ultimate goal of reducing morbidity and mortality from vaccine-preventable diseases. This schematic is complicated, as you see in this diagram, in a more dynamic sense that there are a lot of moving parts. And so, next slide. As we go back to the wiring diagram, if you will, you fall somewhere or have some piece within these boxes for which you can influence or have a relationship with either your patient or whatever role that you have within the immunization system. Next slide. A short overview of the office that I sit in. Congress created the National Vaccine Program Office in 1987 in response to some public health issues that were going on, and charged this office specifically to ensure a collaborative federal environment in which immunization activities are carried out in an efficient, consistent, and timely manner. This office was also charged with develop and implement strategies for achieving the highest possible level of prevention of human disease through immunization. In other words, the optimal use of the vaccine. A third charge was to implement strategies that ensure the highest level of prevention to adverse reactions to vaccines. And the fourth is to support a federal advisory committee called the National Vaccine Advisory Committee. The last bullet point here that fulfills the description of the charge of the NVPO is to identify and bridge gaps in federal planning of vaccine and immunization activities. So toward that end, and the subject of today's webinar is the National Adult Immunization Plan, which, as James has said, was released this year in February of 2016. What's of note is that our office is charged to coordinate amongst federal activities. This plan is not explicitly a federal plan, but it's one that's a national plan, which requires the input, the collaboration, and the support of each other, both in the federal space as well as the non-federal space. So this plan addresses, in part, one of the priorities of the department, and that priority is to prioritize adults in reducing vaccine-preventable diseases as a national health priority. We know that adult coverage rates remain low for most routinely recommended vaccines, and the indicators that you see in the adult immunization plan are well below healthy people's 2020 targets. In response to our National Vaccine Advisory Committee, which is a federal advisory committee comprised of independent, non-federal experts, the NVAC recommended the development of a strategic plan in 2011, which you see the fruits of the labor here. My comments around this plan and around the work that you do in the field is that you've been, as many people, working in adult immunizations for a number of years, decades even. And so this plan, adult immunizations didn't begin when this plan was released in either its draft or its final form. But largely the charge and the deliberations and the call from a wide range of stakeholders was to frame all the activities around that and have a strategic level blueprint toward acting on triggers and levers to push adult immunization enterprise forward and to help support activities that eventually can lead to higher coverage rates. The National Adult Plan was written to facilitate a coordinated action with a diverse set of federal and non-federal partners. It includes priority indicators to draw attention to and track progress against the 4 core goals that are laid out in the plan. The plan recognizes the impact of the aging population and the diminished aging immune response to vaccines. The plan itself has 4 overarching goals. The first goal speaks to infrastructure, the second to access, the third to demand, and the fourth to innovation. The first three goals really talk about downstream sorts of activities and things. Improving access, increasing community demand for adult immunization. The last goal, without the last goal, you wouldn't have the first three goals. I like to say that the last goal, which is to foster innovation in adult vaccine development and vaccination-related technologies. The matter of the cart and the horse, which came first. Without adult vaccines, you wouldn't have an adult vaccination program. The fourth goal also, when hearing from comments from partners, doesn't just speak to fostering innovation in vaccine development, but also vaccination-related technologies. Technologies that can help facilitate the efficiency and the effectiveness of immunization programs itself. So we list objectives amongst each of the goals. The first goal being the one on infrastructure and strengthening the adult immunization infrastructure. And currently we're working on an implementation plan, which is a translation of this high-level strategic document. It hasn't been released, but I've highlighted two areas within Goal 1 that have kind of floated to the top in terms of a priority area, which will be outlined in a guidance document that will hopefully be released before the end of the year. And so amongst these 6 objectives in the first goal, the 2 objectives in green, one around increasing the use of EHRs and IS, and the 1.5, evaluating and advancing targeted quality improvement initiatives, resonated with you as partners, as well as our federal brothers and sisters, as a priority to implement in the next 2 to 3 years. Next slide. The next slide is a snapshot of the appendix in the back of the National Adult Immunization Plan. The purpose isn't to read what the words say, but to see that and remind me to tell you that there's a chart in the back that shows that it takes a number of different players and partners to build and implement the plan. The snapshot here is around federal partners across and within the Department of Health and Human Services, but also outside of the Department of Health and Human Services, such as DOD, VA, OPM, Office of Personnel Management. There's a similar chart that characterizes non-federal partners as well, not listed in the slide. Next slide. Looks like I might have done this. Okay. The second goal, to improve access to adult immunization, has 4 objectives, for which 3 of them were highlighted in focus groups and in surveys to over 100 partners as to which of these goals resonates as a priority action to be addressed in the next 2 to 3 years. The first around reducing financial barriers for individuals, the second about assessing and improving the understanding of providers' financial barriers, and the third around expanding the adult immunization provider network. The third goal, sometimes I pair between the second and the third. If you think of the second goal as kind of supply side, the third goal you might think of as demand. And so the second goal speaks to having places for patients to access vaccines. And the third is speaking about increasing community demand for adult immunization. 2 of the 3 objectives here were prioritized or are currently considered priority items under our draft implementation guidance. And those 2 highlighted in green, one speaks to educating and encouraging healthcare providers to recommend and or deliver adult vaccinations. And the third speaks to educating and encouraging other groups, such as community or faith-based groups, tribal organizations, and the like to promote the importance of adult immunization. These two seem to resonate with a number of activities that we've heard from GSA. So toward this end, in terms of Goal 3 and community access, as we're preparing for flu season, I share with you one tool that we have on the HHS website. It's an interactive mapping tool that is a live tracking of flu vaccinations in our Medicare beneficiary population. Have you ever wondered how your community is doing when it comes to flu vaccine coverage? In this link, we analyze Medicare claims data, and it tracks the flu vaccination claim rates at the national, state, and local levels. You can sort and filter by demographic group, age, and location, all the way down to the zip code level. I've presented a few screenshots to show you the various distribution amongst two states, Maryland and Florida. And also in the next slide, I have to pick my home state of California, and also show Kentucky as well. We're using this on the federal side as a tool to prepare for flu season, to see how this tool can inform programming at the regional or the state level towards flu campaigns, flu communications, flu activities at a very targeted level, as you can see in these illustrative maps. So you can jump on the website, play around, and take a look-see. And we update this with claims during flu season about once a week. The fourth goal, to foster innovation in adult vaccine development and related technologies, has two objectives, for which the first, highlighted in green, we've been told should be a priority in the implementation guidance. So we want to hear from you. We'd like to hear your story, how you're supporting the plan, what sorts of activities you're doing within your health system, your provider practice, your community. We have a website here where you can tell us how you're doing or ask us questions. We are also asking our partners to help promote the plan, recognizing that it's a very high-level plan, but one that frames and puts a blueprint set forth around adult immunization, centered around these four core goals. The next slide is worth mentioning because there is a National Adult and Influenza Immunization Summit. This year's summit theme was making vaccination happen in a changing environment. 2 of the 3 days of this summit focus on adult immunization, with the third focusing on influenza specifically. CDC, NBPO, and the Immunization Action Coalition are the 3 co-chairs of this annual summit meeting. Next slide. For more information on the National Adult Immunization and Influenza Summit, as well as slides from this year's summit, as well as previous summits, you can go to the first link on this slide. The middle link on the slide archives in webcasts and slides of NVAC meetings, for which NVAC addresses a number of adult immunization issues, as well as systems issues. For example, topics around immunization information system, vaccine hesitancy, communicating with parents, so on and so forth. The third link speaks to the NBPO homepage for more information about the National Adult Immunization Plan or the National Vaccine Plan, for which the adult plan is nested within. Next slide. I snagged this slide from one of my colleagues because I find this slide is very compelling, and that in order to advance any or many of these goals, it's really all about collaboration. It's a very popular and very fond African proverb that also resonates in this space that we work in public health and in vaccines and immunization, which is, if you want to go fast, go alone. If you want to go far, go together. I thank you for your time. I thank you for your commitment. Should you have any questions or wish to connect with us at NVPO, please feel free to drop me a line.
Thank you, Dr. Shen. And as you can tell, the national plan is comprehensive. It's been well vetted with input from all stakeholders, and it really sets the stage for future work that will be implemented. At the same time, it's very somewhat overwhelming, you might say, because there's so much there, and you sort of scratch your head and say, well, where do we start? And that was sort of what us, the Gerontological Society of America, to put together a one-day program in the fall of 2015 to look at the draft plan and try to identify what is a reasonable starting point, again, using influenza as a focus. Where can we have an impact if we start now? What can we accomplish without trying to take on the entire plan all at one time? And what we did was look at the 4 major goals that Dr. Shen outlined, one of infrastructure, access, demand, and innovation. And we picked just one objective from each of the first three goals, those downstream activities that Dr. Shen referred to, and picked the 3 objectives where we thought we could have the most immediate impact by virtue of bringing a group together and trying to figure out around those objectives what are the tangible strategies for implementation that we could come up with. So this slide shows the objectives we focused on. One around generating and disseminating evidence about the health and economic impact of adult immunization, including potential diseases averted and cost effectiveness for the use of current vaccines. The objective under Goal 2 was around expanding the adult immunization provider network. And then the objective under Goal 3 was to educate and encourage healthcare providers to recommend and or deliver adult vaccinations themselves. So pushing a little bit on infrastructure, a little bit on access, and a little bit on demand. The meeting itself, next slide please, was 1 day in duration, and we had about 45 attendees there, and I gave you a listing of the various stakeholder organizations who were participating earlier. There were plenary sessions as part of the program, as well as a series of structured breakout programs or facilitated small group sessions to dig into the various topics in a bit more detail. And in addition to focusing on just 3 objectives of the comprehensive plan, we also divided groups into 3 different audiences. One group was tasked with thinking about these issues from a provider or healthcare team perspective, another from the patient, caregiver, or public perspective, and then finally a group thinking about these issues from a policy and system perspective. And what I'll do is tell you a little bit about the output from this conference and how each of the 3 objectives were addressed. The first big area of focus was around this issue of generating and disseminating evidence about the health and economic impact of adult immunization. And we had Dr. Eamon Chit presenting on the human and economic costs of influenza. And a few of the key points from his presentation are shown on this slide, that pneumonia and influenza is a leading cause of catastrophic disability, along with stroke, congestive heart failure, ischemic heart disease, cancer, and hip fracture. That influenza often acts as what he referred to as a silent trigger, as it is not always noted in discharge diagnosis. And he also addressed the fact that influenza really is a systemic reaction. It's not merely a pulmonary disease, as you may think of it, that it affects every organ system, and hence many individuals who may have on their death certificate that it was CHF or stroke or something that was cause of death, oftentimes in the previous week or so, influenza was also part of a diagnosis. So it's a complex disease that has a system-wide impact, and something important to keep in mind. The next slide indicates just what an economic impact influenza has. In the just over 65 population, it's more than $56 billion, and that's in 2003 dollars. And the research is also clear that influenza vaccine for those 65 plus is cost effective and cost saving. So the research is clear on the overall burden, but also on the positive impact in this population, the positive impact that influenza immunization can have. Now the group was charged with thinking about the issue of disseminating this information. If these are the key insights, how do we disseminate this evidence in a manner that is going to be impactful across multiple audiences? And the group came up with 4 core messages that they felt should be part of the communication. One, that influenza is a common cause of hospitalization and catastrophic disability. Secondly, that influenza produces a heavy economic toll on society, and if you look at the entire population, it's estimated at more than $870 billion annually. Third core message is that influenza vaccines are effective for prevention and are cost-effective or cost-saving in adults, and that having an immunized community benefits everyone. So those are the 4 key messages that came out of the discussion, and the groups were then charged with looking at these 4 key messages, but looking at it through those 3 lenses that I mentioned earlier, one around a policy systems framework, one around a patient caregiver framework, and the other around a provider and healthcare team framework. And what I'd like to do is in the next 3 slides show you how those 3 different audiences took these 4 key messages and came up with, I think what you might agree are some fairly different approaches to trying to communicate these core messages, trying to disseminate this important information. So first we'll look at the policy system and framework community. And as you may imagine, their way of communicating this information was, well, it felt like a policy approach. The statements are pretty global and very thoughtful. You know, for example, one of the most effective tools and policies to improve health and reduce the economic burden on the healthcare system is the annual influenza vaccination. Or influenza and its complications are the 3rd leading cause of catastrophic disability in the U.S. Or even more succinctly, vaccine prevention of flu is cost-saving in adults 65 and older. The next slide shows you how patients and caregivers, how that work group really thought about disseminating these 4 core messages. And an example of their thing about communicating with their audience is that, you know, influenza vaccines save lives and improve quality of life. You owe it to yourself and your loved ones to get vaccinated. Or protect yourself, protect your community, keep your workplace working. Again, these are messages you could imagine resonating better with a patient or public community. And then the third group looked at how to communicate these 4 core messages through the eyes of a provider. And I sort of get a kick out of the first one, vaccines good, disease bad. Trying to simplify it as much as possible for providers to get their attention, to say, you know what, we really need to be part of this effort. Reminder that influenza is not just the flu. It is a system-wide reaction to disease, and it's not something to be taken lightly. And then the other one a little further down the slide, just do it. This is your job. All providers need to talk about vaccines with every patient at every encounter. Assess, recommend, administer, and document. And really picking up on the NVAC standards that were published a year or 2 ago. So that just gives you a sense of how the exact same 4 messages could be communicated differently as we're thinking about disseminating information about the economic impact and burden of influenza. The second major objectives that we looked at dealt with expanding the adult immunization provider network. And we were fortunate to have Mitch Rotholz with the American Pharmacists Association join us. And he talked about how you could increase and improve patient access to immunization care. And he set up a model in which really encouraged providers and the stakeholder groups to think about immunizations and your role there as being across a continuum of, at a minimum, being an advocate to encourage older adults to get immunized, to a middle-of-the-road sort of role of being a facilitator. Oftentimes we're in a position, even if we're not immunizers ourselves, we can facilitate older adults getting immunized by having programs in one's workplace or a community center, etc. And then the third part of the continuum, the other end, is being an immunizer yourself. And Mitch, because he is a pharmacist, was able to describe for us the work that the American Pharmacists Association did to ensure that now pharmacists in all states and the District of Columbia and Puerto Rico are able to administer vaccines, not just flu, but increasingly every vaccine, or most vaccines, I should say. It varies by state. And he went on in his next slide to talk about creating what he refers to as an immunization neighborhood, that we need to figure out how to get health professionals across the spectrum to be thinking about their role in immunizations as part of a community or society-wide effort that primary care physicians or pharmacists or nurse practitioners shouldn't feel they're on their own in their own practice to try to solve this, that we are part of a larger immunization neighborhood. And as part of that, thinking about how through better coordination, better communication, and better collaboration, we can increase immunization rates across the life course and bring other health professions into this. Mitch used the example of the pharmacist, but really sort of raises the issue of how do we get other professionals who aren't perhaps active on a day-to-day basis, physical therapists, occupational therapists who deal with older adults every day. Maybe they should be saying to their patients during flu season, have you had your flu shot? Even social workers, who interact with families of older adults could play a role. So that sort of challenged the group to think about it. The group was then, in the breakout session, asked to think about this issue, about how we expand the adult immunization provider network. And they came up with sort of 3 different areas where they thought there could be tactical steps taken to advance this part of the national plan. One had to do with activities that would enhance collaboration among the broad community of immunizers. For example, encouraging all immunizers to proactively establish a relationship with others in the immunization neighborhood. Physicians may want to proactively establish a relationship with a local pharmacy, for example, to refer for immunizations, or a pharmacy may want to establish a collaborative practice relationship with local physician providers, just to open channels of communication. They also suggested that we should encourage non-traditional providers to become advocates and facilitators at a minimum, if not someday immunizers themselves. And as part of that, you would be required to explore changes to state practice acts, for example, to enable some of that work, especially if individuals are going to become immunizers. The group then talked about fostering the development and use of meaningful quality measures. There's a big quality movement, as you're all aware, in the United States, and if we can use quality measures to advance immunization rates, we should do so. And a couple of the specific ideas suggested were integrating immunizations into the quality ratings for providers, developing ways to recognize and adopt quality measures for influenza immunization in particular, and then perhaps creating some mechanism at the state level, but somehow made universal for providers to monitor what vaccines individuals have had, some sort of universal accessibility to an immunization information system was also a tactic discussed. The final major area that the group that discussed expanding the adult immunization provider network talked about was removing financial barriers to this expansion. And a couple of the topics suggested there were actually creating a new billing code and payment for the role of vaccine assessment and counseling for adult patients. And then enhancing education for providers about how to bill appropriately for vaccines so that there can be complete and accurate reimbursement for vaccines. The final objective that we looked at under the third goal, under the demand side of things, was presented by Dr. Barb Resnick, and it had to do with educating and encouraging healthcare providers to recommend and or deliver adult vaccinations. Dr. Resnick talked about the sort of her real-world experience being a nurse practitioner and working in long-term care facilities, about how she gets providers inside her organization aligned to address major issues and empowers them to become advocates for adult vaccines. And you see the 5 steps that she uses to move things forward. One is first is to be or identify a champion. Second is to gather a team. You can't do it all by yourself. The third is to identify barriers and challenges you want to take on. The fourth is to identify a solution that works inside your institution, your practice, your health system. And then finally is to make it happen. The participants were then challenged to determine from their perspective what can be done to reinforce positive vaccine recommendations, and how can we empower individuals who want to take on a greater role to do so. And they came up with 8 or 10 major sort of takeaway messages as shown on the next slide. And sort of steps to take now. And the first one is something that I think we can all resonate with, which is get immunized yourself. I think it's a bit of a challenge to try to lead an immunization effort if you haven't already advocated through your own leadership and gotten your own vaccines on an annual basis. Other action steps to take now are communicating, again, within that immunization neighborhood, establishing those relationships in advance to encourage cooperation, communication, and collaboration. Working to motivate behavioral change, not only among patients, perhaps, to get them to think about the value of becoming immunized, but also among healthcare providers, more particularly, to make sure that healthcare providers are making a strong recommendation to patients about getting their age-appropriate vaccines. Making that recommendation and then ultimately creating a culture of prevention within your practice is really something that the group came up with and felt very, very strongly about. And as the session wrapped up, we talked about how adult immunizations, in terms of how they're measured year to year, have been somewhat stuck where they are. They haven't had a major leap forward in many years. And we try to come up with what's the simplest thing that we could do to try to have a leap forward. And one thought that was put forward is if we could just identify a way to get clinicians, everyone who's involved in the broader healthcare system, occupational therapists, physical therapists, social workers, unit clerks, you name it. If we could just get them, especially as it leads into flu season, to say to older adults, have you had your flu shot yet? We'd be at least taking a big step towards trying to advocate for that culture of prevention that we need to take hold if we're really going to improve immunization rates and achieve our established 2020 Healthy People Goals. With that, I'll close by saying that we invite everyone on the call to really give some thought to how you individually and inside your practice, your institution, your health system, how you can take a greater role in advancing the national plan, the National Adult Immunization Plan. There are a lot of ideas already put forward, and if you go back and refer to the document that's on www.navp.org, you can see the report out from the conference we just described, as well as other resources. There are a lot of ideas out there, and part of it is just deciding where you're going to have an impact, identifying some allies inside your organization to help, develop the plan, and begin. You just have to start somewhere. And as Dr. Shen said, please do keep in mind that we want to hear about your successes, and we want to hear about maybe what didn't work out as well, because others can learn from that. So please do take the time to share your stories with us, and I would encourage all of you to think about attending the National Adult Influenza and Immunization Summit, which Dr. Shen talked about, which happens each spring. It is a wonderful opportunity to immerse yourself in the latest in immunizations, develop new contacts, and to help you in developing your future immunization advocacy plans. Thank you, and I'll turn it back to Maria at this time.
On behalf of the Gerontological Society of America and Angela Shen, I thank you very much for your participation today. Thank you also to Sanofi Pasteur for providing the support for this program. Just a reminder, we are recording the session, and we will send you the access link by email once the recording is available. You'll be able to download a copy of the presentation slides and the recommendations report from the website listed at the bottom on the screen. Before we move to the Q&A portion of this program, please know a webinar survey will automatically launch after the webinar. In an effort for continual improvement, we would like to hear your thoughts. Please provide feedback by clicking the survey link at the end of the webinar. Now, moving along to our questions and answers, just a reminder, you can type and send in questions using the questions feature in the dashboard accessible on the right-hand side of your screen. We will not be using the raised hand feature today, so if you have a question, please be sure to use the question panel. James and Angela will do their best to address as many questions as possible, time permitting, during the last part of the webinar. While we wait for some other questions come in, we've actually had a couple questions come in. This one is for Angela. What are the next steps for the plan?
Thanks so much. The next steps are to release an implementation guidance. And so the purpose of an implementation guidance is to facilitate the translation of the 4 goals that we outlined in this webinar. In the current draft guidance, which we're still reviewing, we present 8 key implementation priorities and related activities. And these priorities were selected amongst the 7 to 8 strategies that are listed in the plan. And so we want to kind of prioritize and map to distinct NAIP strategies. For each implementation priority, we have a list of concrete activities that could be undertaken by 1 or more adult immunization stakeholders in support of the priority in the next few years. We've bracketed between 2017 and 2020. We also provide suggested actions that stakeholders may elect to pursue. So we recognize that the list of activities that we put forth aren't meant to be exhaustive, but rather they represent important activities that are perhaps illustrative of what can be done. We do recognize that many are worthwhile, and while they're not included, stakeholders should not feel limited to these activities. Essentially, what we wanted to do was to provide an implementation guidance that offers suggestions and provides a jumping-off point for stakeholders working together to support implementation of the plan. We are hopeful and trying to target a presentation of this draft at the fall, September and that, though we're not sure whether or not we will be ready at the time.
Thank you. I also see that we're wondering what the next steps are for GSA with regard to the national plan.
Thank you for that. This is James Appleby. As GSA looks at the national plan provides a wonderful opportunity to engage our new champions program. GSA has launched this Immunization Champions, Advocates, and Mentors program, and we envision working through the graduates of that program to implement key elements of the national plan, and we look forward to the guidance that will be coming out around some of the priority areas that have been determined, and we imagine working through those champions to pursue those priority topics.
Thank you. I see a question here. It says, in the VA, there are no incentives for teams promoting immunizations. Does anyone have any great ideas for this person who works in the VA?
Well, this is James. I'll make a few comments, and I don't know if Dr. Shen wants to. I certainly understand the challenges of working inside a large organization. There's no doubt about it. It's extremely difficult in the area of immunizations, oftentimes because the help you often need to make a program go is not an individual that you have any sort of super authority over. It's often a colleague or an acquaintance in another part of the organization. I would recommend the first step being try to sit down with 2 or 3 or 4 other individuals who you think could help you advance your immunization work there in the VA, and start with something simple over lunch and talk about the idea. If you can engage multiple individuals, you can find a way perhaps to create the right sort of critical mass. And these comments don't pertain just to the VA, but inside any organization, complex health system. Getting the right people together and starting some momentum is part of being a champion, and it's sort of the first step down that road of trying to improve immunization rates.
Thanks for the question, and thanks for starting that, James. We, on the other side of the coin, one of the 3 priority areas that my office works on is quality and performance measures. And when we started down this field, we wanted to take a look-see at closed-ish systems for which we have a better line of sight. And 2 of those systems, one Indian Health Service and the second VA, we took a look-see in terms of a quality performance measure, which is a different strategy than what James is suggesting here. And so when we took a look at a pilot project that we started a few years ago, we saw that in the VA, with regard to their system and their registry, it was very difficult to kind of capture immunization. And so stage 1 of our project ended at VA in the sense that their IAS and registries didn't allow for us to be able to assess and evaluate data capture. It did go forward in IHS in terms of a further stage where we developed an adult composite measure, tested it, evaluated it. We're trying to roll this into our GPRA measures. For those of you on the phone who are government, you recognize within our system what GPRA is. My point of telling that very short and perhaps not so scintillating story was that we had to first take a look-see at what the system looked like. And within the VA, it was a game changer in the sense that looking at their EHR vendor, looking at what the data capture is, we saw that we didn't have a line of sight to capture what immunizations were given, because essentially it was an open field, and I'm not getting the proper technical terms right. But it gave us an opportunity, this is before I took this position, the project started, that it gave the government an opportunity to take a look-see at to what needs to be amended and fixed on a systems level at the VA to capture what the to capture immunizations in the VA population. It doesn't explicitly answer your question around incentives to I tried to approach it in a different direction than James in terms of from a systems approach to see what that data capture is so that you see how well or not well you're doing across the board. Because if you don't have a system to capture that, you don't know where you are, you know, in terms of how well the systems are. And then from there, we recognize we work in different cultures. There are a number of things that this webinar has touched upon in terms of change agents and champions and things that can help. Within the federal system, having that rolled into your different reporting measures is really the carrot and the stick that in the case of some of these GIPRA measures you have to do. And so that's not perhaps a very pointed answer to your question about what can be done at VA. We do know from our VA representatives that they're making the changes within their systems to capture what vaccines have been given. And then from there, they can explore how they can improve and, to your point, incentivize immunization by not knowing where they are and how well they're doing that.
Thank you. Thank you again for everybody's participation. This does serve as the end of the program.
Great. Thanks so much.
Thank you, Maria.